Today we have Dr. Diabetes here to help us understand all things diabetes. Dr. Diabetes, welcome! What is the difference between type 1 and type 2 diabetes?
Well, let me explain.
Yes.
Type 1 usually develops in childhood or adolescence,
Okay.
but can occur at any age.
Yeah.
It is usually due to an autoimmune reaction that destroys the...
It's a big word. It's a big word.
It's really hard.
Autoimmune. There you go. There you go.
Reaction that destroys insulin-producing beta cells in the pancreas. So there is no insulin. None. There's none in there. These patients require insulin their entire life. Type 2 diabetes, that's type 1. Type 2 diabetes now is when a person's body becomes resistant to insulin. Insulin's trying to get it, it says no. And the pancreas cannot produce enough insulin to keep up. It is more common in adults, but can be seen in kids. What else can I tell you about it? It's linked to obesity, poor diet, sedentary lifestyle, genetics, and age. It can often be managed with diet, exercise, oral medication, or insulin.
Wow, you're really smart. Dr. Diabetes, could you tell us how a patient might know if their blood sugar's too low?
I'd love to. So, if your blood sugar is below 70, you might feel shaky, sweaty, dizzy, cranky, weak, unable to concentrate, blurry vision, headache, and slurred speech. Pro tip! Cold and clammy, eat some candy.
Wow, you're so smart.
Thank you.
Doctor, how does a patient know if their blood sugar's too high?
Oh yes, I can help. If your sugar is high, you might be thirsty, have frequent urination, dry mouth, feel weak or tired, increased hunger, nausea, vomiting, fruity smelling breath, or unexplained weight loss. Where'd you go? In our pregnant patients, we like blood sugar to be below 120. Pro tip!
Yeah.
Hot and dry, your sugar's high.
Nice, you're just such a smarty. How did you get so smart?
I ate Smarties as a kid.
Dr. Diabetes, is there anything else we need to know?
Well, there is this pesky little complication called diabetic ketoacidosis.
Whoa, that's a mouthful. Could you tell me more?
It is a big word. I would love to share more, but I do need my notes.
Okay.
This pesky rat happens in our type 1 patients and is when the body has no insulin, no more. Remember, insulin helps our bodies use glucose, and in DKA, there is no insulin. In DKA, glucose is stuck in the blood. The cells say, I am starving, I need glucose. So the liver breaks down fats. The byproduct of fat breakdown are ketones. Ketones are acidotic. All of this is what makes up 3 main features of DKA. Are you ready? Number 1, hyperglycemia. Too much glucose, too much. Number 2, ketosis. All those ketones, too many. And number 3, acidosis. Ketones are acidotic. Get it?
I get it. I think I get it. It sounds so serious.
Yes, ma'am, it is.
Yeah. So, doctor, what causes DKA?
You know, I'm glad you asked. It can be due to infection or severe illness, which stresses the body. It can be from forgetting to eat a meal or not taking insulin, or it could be the insulin was bad or something happened to the patient's insulin pump. It can also be due to non-compliance or the patient did not know they had diabetes.
Wow. Patients do that?
Yeah, sometimes they just don't know.
Oh.
They just don't know.
So what symptoms might a patient have if they have DKA?
There's several symptoms, but the most common are excessive thirst, fruity breath, frequent urination, and rapid deep breaths. You might hear those smart people call Kussmaul breathing.
Oh, interesting. What labs might you run to diagnose this?
Normally in my practice, I would check a comprehensive metabolic panel, a CMP. This includes blood glucose, which would be over in a pregnant DKA patient. It also gives us the sodium and potassium levels, so those smart ICU doctors can get the anion gap to help treat electrolyte imbalances.
Oh my goodness.
They will also check an arterial blood gas. This is how you know if the patient is acidotic.
Oh, I see. Gosh, doctor, is there a way to prevent this?
Another great question. She's full of great questions.
Yeah.
It is important to monitor your blood sugar. Check it more frequently. If you are sick, or check for urine ketones. If you have ketones, you need to call. Pro tip! Call for ketones! Woo! If you can't
Call for ketones! Did you get that?
if you can't eat or drink, call the doctor and make sure you are drinking if you are sick. Also, don't forget those symptoms to watch for.
Dr. Diabetes, thank you so much for sharing all your knowledge today.
My pleasure.
You're so smart.
Dr.
We really
Diabetes.
appreciate it. Signing out.